The Scottish Drugs Forum says it's likely more than 1,000 people in Scotland will be killed by drugs throughout 2018. That would be up from the 934 who died last year. The forum, which describes itself as Scotland's national resource of expertise on drugs and related issues, believes a public health emergency should be declared. Austin Smith is a spokesperson for the Drugs Forum and joins us now in the studio. Morning, Austin.
Good morning.
Why? Why is this happening?
Well, what we're beginning to see is what looks like exponential growth in drug deaths, and there are several factors involved in that. One of them is that we're not getting people into treatment, which is the most significant thing we can do in terms of protecting people. And the other is that they're not engaged with other services, so people aren't properly engaged with services around their general health, their mental health, and even housing provision and so on.
So the numbers have been going up for some time now. Is this the usual story of people becoming addicted to heroin and other opiates, or is it spice and new drugs?
So chiefly, as ever, drug deaths in Scotland, these overdose deaths are related to opiate use. So it's heroin, but typically it's heroin and something else. So these are polydrug deaths.
And the Scottish Government says it's bringing out a new combined drug and alcohol strategy later on this year. What do you want to see in that? Well,
we've had the same strategy for 10 years and it's failed on this one measure, certainly, of drug deaths, which have doubled in that time. So what we would like to see is a zero target. It doesn't seem to make sense to have anything other than a zero target for overdose deaths.
Is that realistic?
Well, all drug deaths are preventable. So in the immediate incident of the overdose, that could have been prevented. And there's protective factors we could put around people, including engagement with what are, in effect, NHS services. So like all NHS services, the issue is access and quality. And actually, for methadone and substitute prescribing, it's a prescription that people need. So there's no reason for people to be waiting as they are now sometimes for 6 months to get a prescription.
But you often hear of situations where people are on methadone and still taking heroin and other drugs.
Yes, and that shouldn't be denied. It's about treatment quality. It's about the level of engagement people have in that treatment. People being on a suitable dose that's suitable to them. And holds them, and they're having an approach that's not centred around methadone but around the patient. So the patient should have a range, a prescriber should have a range of substances they can prescribe, including heroin itself.
You talk about treatment, but the misuse of drugs is reserved matter to try and stop people taking drugs. Yeah. Could the UK government be doing more as well?
Well, there has been a call for the UK government to consider at least or allow the introduction in Scotland of drug consumption rooms, and this has become a bit of a focus and obviously a political focus. And that certainly would contribute. That's in Canada, where they face similar challenges to we do in Scotland. They introduced drug consumption rooms, and this has made a difference, not just in people's overdosing on a particular day, but just their engagement with services generally and people being able to reach out to them. But what we should also focus on is what we can do. I mean, the good news is that we're preventing drug deaths in Scotland every day. It's just that we're obviously not doing it in a scale that's required. So we just need to do more of what we do and to do it better and more efficiently.
Austin Smith, spokesperson for the Scottish Drugs Forum. Thank you very much indeed for coming in and talking to us this morning.
Thank you.